Hi, my name is Maria and I'm going to talk about infective panniculitis secondary to Pseudomonas aeruginosa in a liver transplant patient, and this is a case report. Our objective is to report a case of infection panniculitis in a transplanted female, highlighting the importance of infectious diseases in this kind of population. Our case is a 63-year-old female orthotopic liver transplant recipient, and she presented with fever and dermatosis localized on chest and subsequent spread to the knee, right shoulder, and sole of the foot. Dermatosis was initially a nodule and then a bullous lesions and infiltrated erythematosus plaques on the periphery, one of them with a painful central necrotic ulcer. We can see that on figure 1. That is a nodule, and finally a bulla with a painful central necrotic ulcer. Her immunosuppression therapy was with tacrolimus and prednisone. The blood cytometry showed leukocytosis and neutrophilia, and we found an elevation in inflammatory markers like erythrocyte, sedimentation rate, procalcitonin, and C-reactive protein. The hemocultures were negative, and echocardiogram was performed as a part of the approach, in which did not show any alterations suggestive of infection at this level. An incisional biopsy of dermatological lesions was taken, and empirical antibiotic therapy with meropenem and daptomycin was initiated, after which inflammation markers decreased. Histology of cutaneous lesions confirmed superficial and deep dermatitis, interstitial panniculitis due to neutrophils, and in lesion culture, Pseudomonas aeruginosa was isolated. Patient finished antimicrobial therapy with clinical resolution, and we want to highlight that infections of subcutaneous fat are induced by any kind of microorganisms and are more frequent due to the rising immunosuppressed population. An atypical presentation could be found. Clinical presentation is usually non-specific, so its diagnosis requires microbiologic and histologic studies. The clinical presentation and inflammatory response are related with the virulence of organisms and immune response of the host. We conclude that infections of subcutaneous fat induced by any kind of microorganisms should be kept in mind in immunosuppressed patients. Microbiological and histological examination is mandatory for definitive diagnosis, so this will allow an appropriate evaluation and give the best treatment of this special population.